Welcome back to Channel 7 Morning News. I'm your host, Anthony Coulter, talking to you today about joints. A joint is basically any area of your body where two or more bones meet. You have them all over your body and they give you a full range of motion and allow you to function properly. Joints are classified based on how much motion a joint is able to give you. So first up, there are synarthrosis joints, which are completely immovable. You have them in your skull and they basically keep the parts of your skull together. The next type of joints are amphiarthrosis, which are slightly more movable. You have them in your pelvis, and they're just a little bit more movable than synarthrosis joints. And then the final type is diarthrosis joints, which are freely movable. They're the most common type of joints. You have them all over your body, in your hands, and in your arms, and in your legs. Next up is Dr. Tupac Shakur talking to you about the different types of joints.
Hello, my fellow Americans. This is Dr. Tupac Shakur. Today I'm going to explain the groundbreaking discovery of different types of joints and bones. Joints allow you to move your body like this, with my companion Dead Eddie over here. Or I can, right there. Fibrous joints are held together through tight ridges that hold the bones together, like in your skull. Cartilaginous joints are held together by cartilage, as the name would suggest. This allows for much of the flexibility in our body, like in the pelvis. Synovial joints are where the bone really articulates and moves around more. The in-between contains synovial fluid. These joints are usually found in the limbs and reinforced by ligaments. That is all. Dr. Tupac Shakur out.
Thank you, Dr. Tupac Shakur. Next up is Jacob talking to you about bone formation.
Thank you, Mr. Shakur. There is always such a chance that a bone may be broken or damaged. You've likely seen at least one person wearing a cast or a boot in your life. Or possibly, you've even had to wear one yourself. This is usually somewhat able to be healed, to an extent, seeing as there's a little bit more trabecular bone than before. However, despite the fact that bones normally recover on their own, with the help of the osteoblasts, which make the bone, sometimes, without osteoblasts, the osteoclasts will damage the bone to a point of non-recovery. Therefore, we must use outside tools to be able to help fix the bone. Firstly, you can use electrical stimuli to be able to make the bone heal far faster than normal. Tests have shown that this is likely the result of the types of charges within the bone that cause either osteoclasts to be repelled or osteoblasts to go into overdrive. Secondly, you can use ultrasound, which is another tool that we can harness to recover faster, which has yielded a 35 to 45% recovery rate. Outside bone substitutes exist as well, such as Pro-Osteon, a bone substitute that is created using coral that, over time, will be replaced with living bone. Through these methods, the bones and joints can recover even from something that may seem irreparable. Now over to Dr. Mann for more info on synovial joints.
Welcome to Medical 25. Today we're going to be talking about types of synovial joints based on shape. Synovial joints are the most common type of joint in the body and they move freely. Synovial joints can be classified as plane, pivot, condyloid, hinge, saddle, and ball and socket joints. Let's start off with plane joints. Plane joints are found in the hand and the fingers. Moving on to the hinge joints. The hinge joints are found in the elbow and the knee. Now on to the pivot joints. The pivot joints are like the neck, and it allows you to rotate your head. Just like that. Okay, the condyloid joints are found in the jaw, the wrists, the toes, and more. The saddle joints are found in the base of your thumb. Ball and socket joints are found in the shoulder and arm, and it makes your arm do this. Thank you for watching Medical 25. Until next time.
Breaking news. Did you know that one of your loved ones, like this old man over here, could be suffering?
I fail.
And this is called osteoarthritis. A common form affects the elder, like this one right here. It's okay, you're about to die. And this is caused by tear and wear on the joints. Thank you for being here. You can go now. Number 2 for both of your knees. Moving on. Joint pain and inflammation can be caused by various factors, including a fall or a sprain. And the one that we're going to get into today is arthritis. Arthritis can affect more than 100 different joints. Arthritis is the most widespread crippling disease in the United States. And one of them that we talked about earlier was osteoarthritis. But what is arthritis? Arthritis is a condition that causes inflammation and pain in the joints. It can make it hard for some people to move, and it can cause pain while you're doing movements. 3. It can affect people from any type of age. Some symptoms that arthritis can include are joint pain. It can also include stiffness, meaning it will be hard for you to move, and then swelling and decrease of range of motion. But how do you know if you have arthritis? This, you have to go talk to a doctor and perform a physical exam. They will most likely make you bend or see what type of movements you can do. They also need a medical history. They can also test you with x-rays or with blood exams or tests. But what if you do have arthritis? What can you do about it? Well, there's some medications that doctors can prescribe for you. Physical therapy can also help. People will help you do some motions that will be most likely hard for you to do. And thank you for watching Real Doctor News.